both are.
At the same time?
Yeah. We're live.
Hi everyone, it's Candace at Dr. Emer's office. I'm here with Kimberly from Rev Skin.
Yes.
And we are going to do a RevePeel. Now, if you guys have been following our stories, you probably saw me go through the RevePeel about a month ago, and we posted my results, and I'm loving it. I have no makeup on. I feel like my skin looks a lot brighter from my peel, better pores, less texture. So we're excited to give this to Justin, just to brighten up his skin and help with some pigment. So I'll let Kimberly take over because she's the expert. She's been doing this for a long time, and she's a trainer with RevePeel. So yes. I'll let her chat while I prep his skin.
So since Justin has never had a peel before, we're so excited to give this peel to him because he's going to actually get one of the really best peels he could get. So he actually has really nice skin. So sometimes people think that just because you're getting a peel, you have to have really a lot of hyperpigmentation or bumpy, lumpy skin. Actually, no. These peels actually stimulate your natural collagen into kind of perking up. Because as we get older, it gets a little tired and doesn't really want to do what it's supposed to do. So we're just giving it a little to get it going. So, we're going to peel on him, and he's going to actually start peeling on day 3. So we're going to prep him right now. We're going to remove all the oil from his skin. And that way the peel penetrates nice and evenly, and we get a nice even penetration and saturation of the peel.
Strong.
Just don't take a deep breath.
Yeah.
Don't breathe.
Yep, already found that one out.
Yeah, it's strong. So Justin, like we said, it's his first peel, so I'm excited for you. And we didn't pre-treat with anything. We're just doing this on his skin without doing any sort of exfoliation beforehand, because that's how we get the peeling. That's how we get good results. Now, we've shown you guys pictures in the past of people that have done RevePeel, and they aren't peeling as much, and that's because they've been treated maybe with a laser or another abrasive procedure right beforehand, which it's okay. It's still benefiting the skin. You're still getting cellular turnover. You're still activating collagen. You still have benefits, but you're not going to get the dramatic result that I had because I had left my skin unexfoliated for like 2 weeks before we did my peel.
Right. And I like to actually treat the skin 2 to 3 times a year with the RevePeel. And we also have a different formula of RevePeel that you can do in the summertime. So there's a lot of different protocols. You can really customize this peel. So you can get a lighter version of the peel, or you can get a heavier version of the peel depending upon what you're looking for, your downtime that you have available, and really what you want your end results to be.
All
so
right.
Good job.
Okay, so we've degreased the skin, so now we're ready to peel. So let me grab and we're just doing the RevePeel standard, right?
Correct.
Yeah. Okay, cool. So here we are. You guys want to see this?
Mm-hmm.
So the ingredients are salicylic, TCA, lactic, and phenol. And it's about 10% of the acids.
Yes, it's actually proprietary, so we don't really like to say what the percentage is.
Gotcha.
But it is, yes.
Perfect.
In that range.
In that range, perfect.
Do you want me to
And what's
open
the
it?
pH? No. pH is...
The pH on this one
Yeah.
is 1.5.
1.5.
Yeah.
Okay, I thought it was 2, but close enough.
Yeah, 1.5 to 2.
Okay, cool. All right. I'm going to give you this. Thank you. And we're going to do the first coat on Justin and wait and watch how his skin reacts. So let me get a little bit on here. And you're going to feel tingling. The first pass you don't really feel much with.
No, so yeah, you're going to apply just the first pass kind of lightly. And the thing that makes this peel so different, and I feel that makes it a far superior peel, is its formulation is very contemporary, and it is an oil-based delivery system, which we love. So it penetrates the skin slower, so you don't blast the skin with the acids, and therefore you don't get post-inflammatory pigmentation.
We have a couple questions.
Right.
Is this
Yay.
peak good for younger skin? For example, I'm 22 and would love to try a peel. Would this be a good start?
Yes,
Yeah.
absolutely.
And one more question. If I have rosacea and eczema, is it okay to use?
We would probably start you out with the RevePeel Fresh, which is our lighter version with the eczema. We would see how your skin handled that peel first, and then we could always bump you up to the RevePeel Standard. Yes, definitely.
Feeling good.
Tingly?
Yeah, it's tingling. I can feel it.
Yeah.
For sure.
So he's got a nice flush here. That's good.
Yes.
But no frosting or anything?
No.
Really?
So we're looking for the erythema and the flush, and we're also looking for like little spots of frosting.
Two baby frosted spots and a little bit on the nose.
Mm-hmm.
It looks good.
Yeah. Yeah, I really feel it's never too early to start taking care of your skin, especially if you live in areas where you get a lot of solar damage. RevePeel really helps to treat that solar damage, because not only are you treating the pigmentation, obviously he doesn't have a lot of pigmentation, we're treating what's down a little bit deeper and trying to get that skin to the healthy part of the skin.
Yeah. My face turned brown. Like,
yes.
Did you see my face?
Yeah, I did.
There
I
was
watched
pigment?
you every single day.
There was pigment that I didn't know existed. I was horrified. I was like,
I know.
oh my god, I'm like completely sun damaged.
I know.
But
What's the downtime with this? How long does the peeling process take?
So on this particular peel, the downtime is definitely 5, sometimes 7 days. So you really start peeling on day 3, right? You really started peeling around the corners of the mouth on day 3, and then just it's kind of funny because like chunks of skin peel off, right?
It was, and we should repost the video. I was just scrunching my face, and it was so tight. You could see all these crazy lines, but. Day 2 was just tight. Like I couldn't even open my mouth, and then day 3 I was peeling.
Yeah. And then sometimes you'll bend over and pieces of skin will just drop off.
Totally.
Yeah.
All right, so we're ready to
Kind
go
of fun.
for our second pass, okay?
Yes.
So this is where you'll probably feel a little bit of the heat.
Right. Yeah, and don't be afraid to scrub it in.
And how many passes can you do?
4
4.
are the max. But we really pay attention to what the skin looks like to see where we're going to stop.
Yeah.
It's not, this peel is not just use the whole vial and you're done. You really want to pay attention to the skin because everybody's skin reacts so differently.
How you doing?
I'm fine.
Okay.
Looking good. Yeah, it is kind of interesting when you go, like on day 2, you're going to look at yourself and you're going to see all the damage that you did when you were a teenager.
Yeah.
Definitely.
Where are those white spots you're talking about?
Yeah, so this is like the frosting that happens.
Right.
Which this is a sign of a good peel.
That's a sign
this
of a good
gets me
peel.
really happy. I'm excited.
Yeah.
It's really not that bad.
So what is the frosting?
The frosting is when the peel has actually penetrated the skin and it actually starts desquamating the skin.
So that's all gonna come off.
Yeah.
And how many treatments does it usually take for someone who has like heavy skin damage or a lot of sunspots, like on average?
You can actually get really great results with 1 to 2 peels. I really recommend at least 3 peels a year to get like Candace's skin or...
Well, if you have super, super pigmented, wouldn't you go and lighten instead? Would you go that route and maybe do that peel? Or
Not always.
Not always?
It depends on their Fitzpatrick scale,
Okay.
which peel I would do, and how much downtime they have.
Okay. Very
And what
true.
their schedule is.
And does it help with pore and wrinkles?
It does. It does help with fine lines and wrinkles and pore size
Pores.
because you're peeling off the top layers of skin, and the phenol is what penetrates below and helps to really tighten up that collagen, rebuild it.
I noticed a big difference with pores. I was so happy. That was one of my main concerns.
Yeah.
So that was
I
good.
love it for fine lines and wrinkles. Like before I got married, I did just under my eyes, and it was so nice.
Yeah, it just kind of like buffs everything.
Mm-hmm.
Okay, so you guys will notice he's frosting quite a bit, which is great. So maybe just one more pass on him.
Yeah.
Yeah.
I would just do one more pass. Usually, like the cheek area is usually your last to get frosting.
Right.
So I would maybe do. This
Rub it
is
in
what
there.
this is the third one. Coat,
Yeah.
right? Yeah.
Mhm.
So most of the time I'll do 3 layers with a 4th spot treatment. 4th, layer of spot treatment. Usually the cheeks are the last part. Awesome, Candace. That looks great.
You feeling spicy?
I am. Definitely feel
On a
it.
scale of 1 to 10 now.
It's like maybe a 4 or 5. It
it's not
burns,
bad.
but it's not painful.
Yeah.
Right.
And then you feel a little bit hot throughout the day until you wash. For me, I think the other reason I got such a good peel is I left it on like all day.
Could you do it on the eyelids?
No, you can't do it on the eyelids. You can do it on the orbital bone and slightly underneath, but because it is an oil formulation, you don't want it to travel up. So touching on that subject, you don't want to leave it on
Too long?
too long because the oil will make you not peel.
Oh.
Yeah.
I left it on, I know it self-neutralizes, but then you're supposed to wash
Yes.
before 4 hours, right?
Yeah,
Or within 4 hours?
Yeah.
4.
Yeah.
Okay, I probably had it on, because I did it at work, I probably had it on for 6 hours.
That's fine.
That's fine.
But if you leave it on and you don't ever wash the oil off, you may not peel.
Got it.
Mhm.
Good to know.
Yeah.
Okay, cool.
Interesting.
So that's it. That's
looks
really the
great.
peel. So we send him home with a post-care kit. That kit includes a cleanser, a retinol, a soothing balm, and the sunscreen.
Oh.
So he'll pair together the right type of skincare for how his skin's looking. So he's not going to do anything, he's not going to moisturize the skin, he's only going to hydrate new skin, and then he's going to use the retinol everywhere that he hasn't started to peel yet.
Right. So the retinol's going to go on the old skin, and he's not going to use anything other than this post-pill kit because this has been specifically designed for this peel. So this is the cleanser, and it has the silver moist, the silver, micronized silver in it, which is actually wound healing and antibacterial. And then he's going to use the retinol tonight, and you're just going to use a thin film of the retinol tonight.
And that's it.
That's it. Nothing else. And then tomorrow morning you're going to cleanse with the cleanser, and you're going to use your SPF 30. This one is tinted, so it'll be like a little bronzer for you. And it has some vitamin C in it, and it has some botanicals that will help hydrate your skin as well, so you will get some hydration. When you start cracking and peeling, you can use the number 2, which is the Silver Moist balm. It's very heavy, so you want to be very careful how much you use of this. If you overuse this, it will cause the peeling to reduce as well. So you just want to use this on the new skin that comes up, or on areas that are slightly irritated. Sometimes a little bit around the mouth and the nose will get a little slight irritation.
And that's usually the first area that it will peel.
Yeah.
Because you're talking, eating, there's a lot of movement there. So that's where.
And sometimes you get a secondary peel if you over talk and make faces and things like that, that will prematurely lift. No exercising for 5 days. No sweating, because you don't want to prematurely lift that peel. So that's it.
All right.
You are
Thanks,
all
you
set
guys.
with your take home.
Thank you for
Thank you so
tuning
much.
in.
Bye, you guys.
Good job.